pull funding for some vaccines that are being developed to fight respiratory viruses like COVID-19 and the flu. Robert F. Kennedy Jr. announced in a statement on Tuesday that 22 projects totaling $500 million to develop vaccines using mRNA technology will be halted. Kennedy's move to terminate the projects are the latest in a series of actions that have highlighted his long-standing skepticism towards vaccines within the nation's health department. He's retracted recommendations regarding COVID-19 shots, dismissed the panel responsible for making vaccine recommendations, and refrained from strongly supporting vaccinations as a measles outbreak escalated. The health secretary criticized mRNA vaccines in a video posted on his social media, justifying the decision to cancel projects led by the nation's top pharmaceutical companies, including Pfizer and Moderna, which provide protection against viruses such as the COVID-19 virus and H5N1. There's a quote here: "To replace the problematic mRNA programs, we are all focusing on the development of safer and more comprehensive vaccine strategies, such as whole virus vaccines and innovative platforms that remain effective as viruses mutate." That is from the Health Secretary of the United States, Robert F. Kennedy Jr. We're once again joined by Dr. Nagao. Dr. Nagao, what are your thoughts on this? Obviously, RFK Jr. is a long vaccine skeptic. There were a lot of worries about him coming into the role that Donald Trump nominated him for as health secretary. Now we see his views coming into practice with this $500 million in funding for vaccines. What are your thoughts about the new health secretary's approach to the way he goes about his government role?
Yes, Kennedy does not believe the vaccine is variable. So that's why if the U.S. government will not continue the research about the vaccine, and the delivery system will be damaged by not funding this, it is okay for him. But at the same time, the view from the vaccine supporter, I also, but these people, this is not.
Oh, I apologize. I believe we have had some technical issues there. Hopefully we get Dr. Nagao back very, very soon. However, we are covering this $500 million cuts that the US Health Secretary has made to mRNA vaccines, which help they help things like COVID-19 and other respiratory illnesses. Dr. Nagao, I believe that you are back with us once again. Apologies, there seemed to be some sort of network issue. What more can you tell us about this situation of the US Health Secretary cutting $500 million worth in aid from vaccine programs?
Okay, I will explain a little bit summary case. Yes, he do not believe this is variable, so that's okay for him. But the supporter for the vaccine, this is damaged. But anyway, the Trump administration direction is they try to make the government small. So not only this case, but also the other case, they try to cut the funding. So that's why this is one of the area the current Trump administration cutting the funding. So cut funding and creating money and to use other is his policy. So that's why the view from this area that this is not bad. But view from the people who support vaccine, not research, not develop, not deliver, that is not good for the next pandemic. That's also true, I think. So without someone's fund, maybe research will end and we'll face a new crisis in the future. But that time,